Incision wise, what are your incisions? How do you decide where you make your incisions?
You got to place the muscle on traction superiorly, so that way you get like an idea where your incision is going to lie when you have the pull on it,
Yeah.
rather than marking it and then closing. Biggest part are the markings.
Yeah.
It's usually about like 7 centimeters above the vaginal opening. Should hide well. It's curvilinear. Should hide well in underwear bottoms, bikini bottoms.
Yeah. Making the incision at 6-7 centimeters above the commissure is usually what I do. And I think that gives the best results. Sometimes even if you end up with a small vertical, that will even hide underneath an underwear or bathing suit. And that also gives you kind of a monsplasty. It gives you a lift in the vaginal area, which helps out with the aesthetic results quite a bit. And then laterally, we go to where the tissue is, right?
Yeah.
Like a lot of people are like, I don't want the big incision, but sometimes if you want the best results, otherwise you're going to end up with dog ears. And that's one of the things with the higher BMI you go, the longer the incision has to be to try to get what you can out of there. For the muscle plication, do you tend to use a permanent suture, or do you use something that dissolves slowly?
Yeah, it's something that dissolves slowly.
Yeah.
Really thick suture, but dissolves over a few months.
Yeah.
I don't like using permanent sutures anywhere on the inside.
You know, I've had multiple patients, like they had abdominoplasties 20, 30 years ago. They get recurrent infections or seromas, like, you know, after 20, 30 years. And I'm like, I know exactly what it's from. And I open up their abdomen and I'm removing the permanent Ethibond sutures, which, you know, in training, I used quite a bit too, because we did tons of tummy tucks, and, you know, some of the attendings were adamant about Ethibond and the permanent sutures. You know, you want something that holds strongly. I love the Ethibond suture, but I don't love using it.
Yeah.
It's a great suture. It's permanent. It's soft. You don't feel it, but like, you know, it's something that you could. I just did a lady that, you know, she had a gallbladder taken out, and, you know, the sutures from her belly got infected afterwards. And she got sent to me from one of my friends that's a general surgeon. He's like, I can't get this thing. I even washed it out. She keeps on getting recurrent infections. And I was like, I know what it is. Just send her over and I'll take care of it. And it was exactly the Ethibond sutures that I ended up removing. So that's that. And then how about the belly button? What happens to the belly button?
Make an incision around it, preserve the stalk. Once you draw that tissue down, you mark where it is. I know you like to go just by measurements on most people, and it's fitting for most people.
Yeah.
It's about 9 centimeters above like the incision line. Bring it back up, suture it. I know everybody does something different. They've tried to research it. I personally like that smiley face.
Yeah.
But I like to make that smiley face incision on the belly button too.
Yeah.
And on the hole you make to bring it out. I think that gives the best look, because that top of the belly button sinks in, and obviously taking a ring of fat out where the belly button's coming out too. So that gives you like the nice contour, kind of hides the incision around the belly button on the inside as well.
And for the belly button, do you tack it down so it shortens it, or?
It matters. If it's higher BMI, I usually don't.
Yeah.
Where I think they could actually probably benefit from it more, but I don't want to put too much stress on it, like decrease the blood supply and like run into like a dehiscence or the umbilicus dying out. It's case by case. How about you?
I tend to do more. I tack it down because I just think it hides that incision line pretty well. So how long that lasts for my patients, you know, even long term, I've seen it, you know, even using like Vicryl or something to tack it down.
Yeah, I think if you get the initial scar tissue, I don't tack it down like in the traditional sense. I usually do 1 to 2 points.
Yeah, I do 2 points usually.
Yeah. So that's superior point. I definitely do.
Yeah.
That does, again, give that natural hooding of the top portion. If you get that, I think you'll get a good result.
Do you perform lipo with all your tummy tucks? And how aggressive are you with the lipo?
Yeah, so in training they tell you not to, and some old school people won't do lipo. I would say I'm on the aggressive side with the lipo, and gradually year by year become a little more aggressive, especially around the flanks. Even not if it's not centrally, Centrally, I do enough to get a good contour.
Yeah.
I still do it centrally. And it's pretty much every patient, unless like you get a rare one where it's just excess skin with zero fat. And that's, I just have.
Yeah, I like to mainly do like Lipo 360 on everyone that I do a tummy tuck on. I think it's so important to do the Lipo 360 unless they've already had it. Trying to get that curve on the back is like so hard from the front, even with the angled liposuction cannulas. So I like to get the contour of the back first and then flip them over and then contour the front and then take out the skin.
It gives you multiple angles for the sides too.
Yeah.
That's the nice portion without making an incision on the upper thorax.